And we have,
Everyone's 10
Oh,
minutes,
yeah.
I have to leave.
I'm going to give you an agenda. This is the PAC Region Administrators.
Okay.
I'd like to speak to the Board of Health.
all right, let's get her done.
Can we introduce ourselves first? Can we? Yes, please do.
Hi, Lloyd White, Administrator, Marion County Health Department.
I'm Denise Noble, Administrator of Preston County Health Department.
I'm Boyd Van Horn. I'm the administrator in Taylor County.
I'm Chad Bundy, Administrator of Harrison Clarksburg Health Department.
I'm Lee Smith, I'm the administrator of Mon County, also the county health officer.
You want to go ahead around the room? Yes.
GDB, Dodge County.
Ms. Linda, County Health Department.
Mark Whitaker, Environmental Health, Dodge County Health Department.
Debbie Davis, Administrator.
Louis Knight, Board of Directors.
Steve Smith.
Chairman.
Chairman.
Huh?
You Chairman.
Oh,
You may.
Steve
Hey,
Smith, Board of Health. Yes, sir. It does.
Ralph Sandor, Commissioner.
Kathleen Board of Health.
RIS Board of Health.
Tammy Beamer, Citizens Reporter for the Herald Record.
You guys, you're on, I
Been elected
guess.
to at least lead off.
You're the leader on the agenda.
Basically, we just wanted to come, we heard that there's some difficulties with local health departments just across the state of West Virginia right now. There's some legislation that's out there that's very concerning to all local health departments. And we're very concerned that that can affect any one of us within what we call our region. Let me first just talk about what our region consists of. We were thrust together, I think, in 2013, 12, I'm sorry, in 2002, 2003.
Yeah.
As a threat preparedness region, first and foremost. And that's when dollars were coming from the federal government through the state, following the 9/11 attacks and those type things. And we all came on board, started dealing with crisis along those levels. And we've been, that's the counties represented here are called the PAC region, and it's the threat preparedness region. What that did over a 10, 12, 13-year time period is really bring us together as counties. And we rely on each other on a lot of different things, not just threat preparedness. If I have a question, I work on with Debbie on finances and a lot of different things. I'll call each one of these administrators on a regular basis. We quickly, as we became comfortable with each other's relationships and expertise, we call upon each other for those things and have been very successful at doing those things. We've had crises we've dealt with as a region, whether it's been pandemic influenza. We had a crisis in Harrison County where we activated the PAC region. We had a meningococcal outbreak at a local high school. All members from the regional structure came in and assisted with that, whether it be nursing or environmentalists, all those type things. We had Hurricane Katrina that Ms. Noble could talk about. She was charged with standing up a shelter in Kingwood, and all members from the region reported to that and stood up for that, and we utilized our relationships, I think, as much as anything else, the fact that we've worked on a regular basis to put down some of those crises. So to be quite frank with you, we heard that maybe some considerations were looking at, Doddridge looking at leaving this region, to be quite honest with you, we don't like that. We've become dependent on Doddridge in a lot of ways. We think they're an equal part of our region and take the lead in several areas. We've all been down to the park down here on a regular basis and trained in emergency services and those type things, and become quite dependent upon each other. And be honest with you, we just want Doddridge with us in the future, whatever that means. We've again worked a lot of different ways, just not as a PAC region or emergency preparedness, but we're starting to reach out in different areas as well. For example, under community health promotions, just recently, we've all agreed to work community health assessment together, develop health improvement plans for those assessments, and determine in our regional structure, what's needed from all of us in our regional structure as far as the citizens, what's their best needs. And that's worked quite well. We're just getting started in that arena. The good news is those things, when we work together, often do save dollars in that community health assessment model. I started that in Harrison County. You've probably heard something about accreditation and those type of things, but being able to do a community health assessment and meet accreditation standards just for Harrison County is going to be about $7,800 to bring a professional in, has all that expertise, and work through that, sometimes up to a year structure. When we expanded that to the region, we were able to drop that down to, I think Harrison County's got about $3,000 part, as opposed to the $7,800 that we had. And everybody, I think, has a lesser amount as far as that is able to concern. Significant lesser amount. And that's just one example. The bottom line is, regardless of how we move forward in the future, and some of the legislation coming out will probably dictate some of that potentially, or something may change in the future, however we move forward, we want Doddridge County as part of this PAC regional structure. We just kind of dependent on them, and we want them to continue to be in that structure, whatever that may bring. So we all came out this evening basically this to ask you that question: what is it that Doddridge needs to continue to stand up, be a leader in the Doddridge community, and as important, be autonomous and be the Doddridge County Health Department. So what can we do to help you if indeed you need any help at all? If anybody wants to add on to that, by all means, if you have any questions, I'll be happy to.
Well, let me just kind of add to that, because we believe the strength in the local community lies within the local health department. The ability to make decisions then in the type of a crisis. Or I can tell you from my county commissioner standpoint, when they call me, they want an answer then. They don't want to wait 2 days, 3 days for somebody else. You know, we have to be accountable and responsible to our citizens in our county. We think that the best way to do that is have a strong local presence, fully staffed. So that's one of the reasons why we're here. We want to make sure that, you know, when you make the decisions, that's all of our goals, is to make sure, because we believe that the local health should be the hub of a community. I mean, there's, all of you know, Debbie knows, you all provide services for the underserved that otherwise wouldn't obtain services anywhere. If you don't have a strong local presence, I can assure you, I doubt that people are going to drive to other counties to get the service. I mean, we talk about health care, where we stand with our health status. We know it isn't good. It's never been good. And one of the barriers to health care has always been accessibility, transportation. So when we do things to kind of increase those barriers, and we do things to decrease the health status of our citizens, so that's, you know, whatever decisions that we made, we try to make those with the citizens' best interests at heart. So everyone wants convenience. They want to go to their local health department and get an immunization rather than driving for an hour to get an immunization. So those are some things that we think paramount is having a strong local presence in the community.
And I'd say each of us representing our counties, we want to continue to stand alone as a county in our health departments. We collaborate, we depend on each other for advice, for information. We collaborate with things with the community needs assessment, with threat preparedness, but none of us are interested at this point in regionalizing. We believe in our health departments, we believe in our counties, we believe the answer is local control, local say, and providing services locally. That's where we're coming from. We may be forced into doing something else, but that's where we're coming from. And we want Doddridge County to continue to stand alone and for us to help in any way that we can, if there's assistance we can provide. But Debbie is an equal partner with us, and we depend on her for, you know, advice and for the relationships we've formed, and we really want to continue that.
And I echo those same comments. We stand together on this. There's been a lot of ways that our health departments have worked together and helped one another. I've come to, or sent people to visit with Debbie and observe on how her nurses work. Yeah, we're the home health partners, Deb and I. Taylor County has a home health program, and in this region, we're the only two health departments that have that. So we're picking one another's brains often regarding that and looking at how the operations work. And but you know, we agree that it's best when a local health department can stand up, be autonomous, and be a part of the community in which they reside, because you can address all the health issues and the things that are particular to that county. I mean, every county's different. Look at Mon County compared to Doddridge County, for example. Just two different kinds of counties. But besides the healthcare aspects of it, there's also the funding and financial aspects. In Taylor County, as in Harrison, I know you guys have just read the papers, the reason I know this, but we have a levy in Taylor County, and I would dare say that if there was a regionalization situation, it's just really going to throw a wrench in the spokes of the funding mechanisms that are in place. I think, again, as a group, we agree that we want to improve public health, but we don't want to work we don't want to be regionalized and controlled by some central authority. We want to collaborate together and raise the standards in public health and increase the things that we're doing collaboratively. And I really think that's the best solution. And we can go down the list of things that we've already collaborated on and are working on. But unfortunately, that's not necessarily the picture that's being painted from Charleston and a few other places. So my message from me personally and as a member of this group is that we want to stand together. We want to support one another as we have been. And I guess the end point is we're here to help. As Chad said, if help is needed, we just want you to know that we're with you.
Well, I guess that leaves me.
Well, you're the smartest one. We saved you.
I should have said
Make
here.
it good.
Yeah.
Make it good.
I won't tell them you're a lawyer too.
Oh, there went his credibility.
I was warning you guys.
Yeah. I think of it in analogies. Yeah, I love analogies. To me, it's a little bit like rock soup. This county's got that, this county's got that. Together, there's strength in our numbers. This packed region is a natural fit. We're connected by the highways, we're connected geographically. Same kind of people, same kind of problems, separated some ways. We have a lot of strength in numbers. Together, this whole area is about 280,000. The cutoff, what the people who are policymakers, they say that you have to have at least 100,000 to really make an impact in the public health. You got enough of a footprint that what you can do is important. And so we're clearly there, and we would not want to see any part of this disrupted. We have history together. We know each other on a first name basis. You pick up the phone, you got administrators from all different health departments come down here and an act of solidarity to show that we work together good as a group. I'm the newest one here. I've only been in my job a year, but I know from history of being in Morgantown how everybody pitched in at Camp Dawson for Katrina, and how when there's vaccine shortages, people will drive to each other's places. When there's a question about what's the best way to build, what's the best way to do that, working as a group. So certainly support that. I think that all emergencies start locally, all solutions start locally, and all responses start locally. And we have opposed as a basic tenet that the Charleston-centric view that people have down there in Kanawha County, that everything rises and the sun sets and rises right there, is not what the reality is in the world. And so we work together well. We think that it's important to continue this basis. We do not support the issue of the regionalization, because if you start to tinker, if you got so much money and you're going to start cutting away at that, you're going to change the structure. And so it's a good theory that if you get rid of 40 administrators, you're going to save some money, but it's tough to find 40 people who won't fall on their sword, so to save some people some money. So the situation that we have at present is functional, and we want to continue that way. Again, Charleston, they'll do what they do, but I see nothing wrong with the situation as it stands right here. And I just want to say that even Mon County, they look at us, you're the big guy on the block kind of stuff. Bigger area, bigger problems. So we've got that going for us. And so, but from the small to the large, it is when we meet, it's equal partners. So whatever we can do to maintain that, I think is for us what we think is going in the right direction.
It doesn't mean we always agree. I want to be clear about that.
It's brothers and sisters.
But we work it out, and we've said this in the past. There may be times we disagree with things, but we knew if we picked up the phone and said, "I really need your help," people would be there in a heartbeat, right, Deb? And in our history together, there have been many times where Charleston has looked to the PAC region, the way we do things, the way we operate, and used it as a model for other places in the state and doing things. We've developed tools that they've then used, recommended using statewide, and but I didn't want to give a total Pollyanna picture. We do have our disagreements. We, feel strongly for advocating for our counties, and in the end, we do what we feel is best for our counties, but with great support from the others.
That's one of our biggest strengths, is each of us brings our county's perspective to the table. I'll fight tooth and nail for Harrison County. That's what I work for, that's where I'm at, that's who I'm supposed to be protecting. And Debbie brought that position for Doddridge to the table, and we sorted it out. You don't have that position at the table, I think something's lost. We're solely supporting our counties, and we're coming together with a regional structure and a solution, but it's not make sure everybody's needs are met. And I just think when it gets bigger than that, it's not as strong. Certain of it.
What we're understanding is, and we've been hearing this, that the state wants us to regionalize. I mean, that's been the big talk. And we sort of ignore it. But what we're concerned about, and what has brought this to a head, is the 25% that the governor is talking about taking away. Now, how are you, different counties, going to handle that and still stay by yourselves, still be a county entity?
Well, the strength of that is each county, being a administrator here, is responsible to that county, and everybody has probably a different plan for their county.
That's what I understand.
But when we come to Doddridge, what we're saying is we'll impact you as minimal as you want, or we'll come and help you in a maximum level as you want, whatever is needed at Doddridge. Bottom line is, you all best know that. And if you need the help, we want to be the people you ask for help. It's simple as that. I'll give you an example in Harrison County, which I know well. Bottom line is, we get about $494,000 last year from the state of West Virginia. Represents about 40% of our budget. It's going to take away the 25% cut if it holds. I hope it doesn't. We're going to the legislature tomorrow as a public health association, local public health association, to hope educate some lobbyists, some legislators to reduce that amount. But if it holds, it'll mean about $120,000 decrease for Harrison County. And we'll be looking at some difficult decisions in personnel and benefits and programs that we can complete in. We're fortunate to have a pretty significant savings in my county, and we'll apply that over the next couple of years if necessary, and work through our layoffs and those type things through attrition, so that we don't have to go in there and do those type things. That's just my county. If anybody wants to share what their plan is.
Well, I'll comment because I'm a small county. Similar, Doddridge, my population is 16,900. So I'm not sure what you're on.
Half of that.
You're double us.
So I have, when it comes to a budget cut, I'm going to have probably my perspective is more similar to yours than it will be to his. Because the smaller the county, the less we lose, the less we have to make up. And I'm going to tell you, the collaborative effort just on this assessment piece alone is a significant. I'm going to lose about $43,000 in my health department. So that's a whole lot less to deal with than what these guys are going to have to deal with. But this health assessment alone, for me in a small county, that collaboration on that is a significant chunk of what I need to make up. So if I'm saving $5,000 on assessment, 5 out of 43, that ain't bad. That's just one project. So that's a perspective right there that I'm anticipating making up some of my, and I intend to do the same things Chad's talking about, use attrition and scale back where I can and look for more growth in areas that I can. My home health is where I'm trying to grow.
How many of you have levies in your county?
Yeah.
2.
Yeah.
I can tell you how we plan to deal with the cuts. First of all, let me tell you that according to the Senate Finance Committee, the Bureau withheld $6 million of our money that should have been in our line item budget that didn't get passed on to us. So we're going to ask that be restored first. Secondly, we're funding 6.7 FTEs out of our budget that should be funded by the state. So that's the money side of it. At the end of the day, I got to be honest with you, and I've said this all along, I don't think we're going to get a 24% cut. Do I think we'll get a cut? Sure. I think we'll get upwards of 7, 8, maybe as high as 10% cuts. I really think realistically that's what we're going to end up with. So how do you do with those potential cuts? For us, if it were a 25% cut, we would lose $105,626.72 just on the surface. So we can't obviously look to make up all of that. So I see your fees for service structure. We just redid our fees for service, so we're going to increase services and things that we can do. We're going to expand our services that are billable services to offset some of those costs. We run pretty lean as it is. When we have a position that becomes vacant, I do a total analysis of that position. What are my needs? So consequently, when we've had folks leave, we haven't automatically filled those positions just because we could. Having said that, we have a decent bank account set aside to cover some short-term losses in the event that it's need be. I don't know if you watch Decision Makers or not, but Governor Tomlin was on there probably 3 or 4 weeks ago, and he actually said by 2021 they project $185 million surplus. So if we could just kind of get over the hump, it does look like all budget projections at that time are looking pretty good. So I think, doing a total analysis, and I sit on the state's emergency funding committee. What that does, if you have a health department that's about ready to go under for whatever reason, and you apply to the state for emergency funds, then our committee comes in and we do a total top to bottom look at your health department. Where we think you can cut expenses, where we think you can increase revenue. And so we've always done it in our office. If Doddridge County ever faces that, we'd be happy to do the same for you as well. We come in, we do a program analysis where we think, again, you can increase your revenue, decrease your expenses. I mean, all of us know when you look at budgets and when you look at revenue, just like our private homes, that's what you have to do. If you can't increase your revenue, you've got to decrease expenses in some capacity. Ideally, you decrease expenses and increase revenue. If that can be done, then that's great. But if not, you have to look at where you're at, where you want to go and how you want to get there.
We've worked as consultants for other counties before. For instance, 3 or 4 years ago now, I was the president of the Association of Local Health Departments, and they gave me a call and said, Grafton Taylor is losing their administrator. They need someone to take a look at some things, and would you be interested in doing that? I said, sure, I'd be able to do that. Of course, went through my Board of Health and our appointing authority, County Commission, and City Council, and they said, sure, go ahead and take a look at that. We went down there. I'm sure none of you have ever heard about that. And the reason you haven't heard about that is we didn't follow the same model in Canal Charleston, Putnam, where we took over the county. We didn't do that at all. We went in, looked at those things, did all we could to support them, and they hired a great administrator, Mr. Van Horn, and they've stood up now and they're just flourishing. At that same time, another county, they called me again as the president, they called me and said, hey, would you have time to take a look at this county? I said, I really don't. I said, I'm working with Grafton Taylor. I really don't have time for that, but I referred Mr. White to them. He consulted with them. And again, you didn't hear about that at all because that's not the Putnam Canal Charleston model. He went in there, took a look at those things, stood that county back up, and again, that county is operating very strongly. Mm-hmm. So this is not the first time this has come to our place, and this is how we respond. We want to stand, anything we can do to help Doddridge stand up. And that's, again, in terms of what you guys think you need, we just want to give you the avenue to come to us, and we'll be happy to try to provide that. And that could be a minimal amount or a lot.
That's easy. You can help us, just give us some money.
I'll put down a 1 and fill out 0.
One of the common things I heard everyone of you say is, I want, or we want. But we don't usually get everything we want. What I'm hearing out of Charleston, what I'm hearing and stuff, doesn't sound like you're probably going to get what you want. You're probably not going to get to stay autonomous. I mean, you all really believe that you're going to get to stay autonomous?
I do for at least a year.
Yep.
Because I think the legislation that was to be introduced this year, I just got to give you a little bit of a background. Dr. Gupta, when he became commissioner, President Bundy and I met with him and on several different things. One of the things that he chose to do was convene a task force. Now, folks, I got to tell you like it is. I've known Mark forever. I'm a straight shooter. I tell you like it is. I don't honeycomb a thing. When you appoint a task force, when you have most of your people on it, you have an objective and the goals that you want to get achieved. Well, that didn't happen. So because the task force didn't come out with a plan to regionalize, he had one member of the task force, Senator Walters, to introduce legislation that would regionalize local health departments. So we give him 100% total control over everything. That bill says administration and services. There's nothing else. And everyone finding out what's going on and how Dr. Gupta really operates, that bill did not get introduced. So it doesn't have any steam. And if it didn't get introduced today, I think today's the last name it could be. So the conventional wisdom is that it wouldn't have a chance to pass. So that's why I can really say that nothing's going to happen this year because there's no bills to introduce the legislation. We think that moving forward, there's so much lawmakers in favor of local control, keeping the local health departments right in their communities. I don't think it'll ever pass. I really don't, because I've talked to a lot of lawmakers. Geez, everyone I talk to really support having a local health department right in their community that they can call and get a result, then not have to call somebody on a regional structure. You may get a response, you may not.
What do you think about that they could have a backdoor approach, that they could make it, that Gupta and his supporters could make it so difficult that local health departments couldn't stand alone, that they put the requirements on local health departments that they can't survive?
Well, sure, I mean, that's a possibility, and I don't doubt that. I think, you know.
That's why we're standing up.
I think that is the intent behind Senate Bill 506, which has a element in it. It is three-pronged. Number one, it's supposed to alleviate some billing concerns for local health departments, to make it easier to bill. Okay. Number one. Number two, it's supposed to make it a little bit more difficult for health departments, maybe adding to their minimum packages, adding emergency preparedness, some other things to be required by local health departments. And then the third prong is expanding public health emergency authority of the commissioner. If you're not meeting those first two, then you can come in with greater authority and do those type things. We've had discussions on those things. If we are forced, and it's not our primary mode of operandi, but if we're forced to regionalize, then we want to regionalize together. We've had those discussions. If we have to regionalize, then we want to say, okay, well, this is the region we want to be. We want to regionalize together, and we're forced to do that, then we'll operate in this region. And we touched upon what this region looks like. Okay, we're not 100,000 population. This region comes together, which includes Doddridge County, and we want Doddridge County with us. Okay, that's the key. We have 285,000 population. We come right down the I-79 corridor. We stretch into the mountains of Preston County. We have major hospital system of UHC, 2 hospitals with Western University Hospital, Western University itself, University Hospital Center, Fairmont General Hospital's got a new name, and I apologize for not knowing. I live right beside it.
Fairmont Regional Medical.
Fairmont Regional Medical, the VA hospital system.
Don't forget Preston.
Mon General, on and on, the VA hospital in Harris County, Grafton Hospital, Hospital Preston, on and on and on. That's just the hospital systems. What we're saying is, if we're forced to be a region, then we're going to be a power. We're not going to be this region and just going around. We're going to leave, as like we're doing right now, in a quasi-emergency preparedness regional structure. Within our regional structure, we have a full-time health officer now in Mon County. So there's a lot of pieces to that puzzle. If they make us be a region, and that's not our first mode, then we're going to be the best region. And again, we want to do what we need to make sure Doddridge can be a part of that. They've been a part of that for the last 10, 12 years in our emergency preparedness. We function at a very high level, and I think a lot of things indicate that, and we want to continue that. If we're forced to work fully together as a regional structure, then we'll be the best region.
Let me go back to your question as to why I don't think that the regionalization is coming this year. 2 weeks ago, there was the press conference that Cabinet Secretary Bowling and Dr. Gupta were in, and they were asked directly, does this have anything to do with regionalization? They said, no, we were not addressing regionalization. We're going to go with a 3-pronged approach. We're going to improve billing. We're going to increase the plan and give additional powers to Dr. Gupta. That one sort of fell on hard times. So the modification of 506 may be reintroduced tomorrow. But going back to your question of what to do in this environment, I think is important. Now, we probably have the most because our budget is larger than many counties. So a 25% funding cut to us is $178,000. That's a lot of bake sales, a lot of car washes. And so what we anticipate doing to come up with that is that if we got to look at the business plan that we have. So environmental services can only inspect what's being built. They really are not in charge of that. They're just sort of a passive recipient to what the construction is in that community or what the restaurant is. The public health nursing, however, I think is the only place that we have the ability to grow. Now we're fortunate we have a dental clinic with us. We have the WIC program with us, which is also regional, which is the same region. Our epidemiology is always the same region, plus Barber County. And so we're quite used to this formula, but I think, you know, what your economic advisor would tell you is you got to diversify your portfolio. And so the only place we can grow is to expand into the clinic area. And so if you're looking to, you know, I'm not sure that I believe wholeheartedly that we're going to bill our way to success, because if all you can bill is Medicaid, you know, that's kind of, you know, pennies on the dollar type of stuff. So you have to think about doing other things. I think that the time is right to look. I wish we had a home health. They mistakenly sold it a couple years ago, but the 2 counties that have it are doing well, and that's an area of great opportunity and expansion. Right now, hospitals are trying to figure out a way of not having a readmission in 30 days after discharge. So if you admit somebody for congestive heart failure, they go back to their same environment, they're still eating the same chips, they're not getting their medicines filled, and in 30 days it shouldn't come as a surprise they're back in the hospital. So home health can make a very positive impact on that. And that should be something that can be negotiated. The hospital's got something on, they got some skin in the game now, and would be an opportunity to expand those kind of services. I know that in Charleston, they're looking at the community medic, trying to get EMS expanded in this area. You know, at the School of Public Health, they're looking at what is the community health worker look like, and what do we do. So that whole area is ripe for growth. It's really going to be big. The next thing on the agenda is telemedicine. The ability to bill for a patient interaction. Nurses can bill for that, as well as physicians, in the patient assessment. How are you doing today? A lot of growth in that particular area. Other things that can be done, but I think clinic growth is where there is a potential, and that's what we're looking for, is to try and make up some of that 178,000. If I break it into how many patients, I need an extra 300 patients a month. And so that's going to be tough for me to come up with, because, you know, I'm in the shadow of WVU. So we have to be a little creative in how we're approaching that. But every opportunity that we see, we're trying to put it into an opportunity to reestablish us as, you know, because prior to my being there, Morgantown was a sleepy little health department as well. They had advantages because they were big and in a metropolitan area, but, you know, we're facing the same issues that everybody else is facing. So I don't think that it's going to be an issue this year. To be frank and just put cards on the table, I'm not sure how long Dr. Gupta is going to be around. I hear from Charleston, people who are his detractors will say that he has exhausted his political capital. And not everybody is, you know, listening to his spiel with, you know, great attention. So it really has come against the grain to say we're going to mandate and force you guys. I know the county commissioners from Montague County, they're very much against, they're not against working together, but they're against, let's just take our tax dollars and cast them to the wind. That's not good, you know, stewardship of public funds. And so, you know, there isn't always that nice way to meld Kanawha County and Putnam County. You know, that came at a crisis moment. And so we're okay as we stand right now. I think that we continue to try to work as a group and overcome these things as they arise. But, you know, we're just going to have to do this one day at a time. There's no golden goose or, you know, pixie dust that's going to get us out of this. Just, you know, hard work and trying to make intelligent decisions about where the future is.
And I think a lot of scare tactics were being used to try to have people voluntarily regionalize so that work was done for Charleston. And then they could a lot easier move forward. And, you know, and that's why we're really standing firm that we want to stay the way we are, and we're not going to rush to regionalization. But I think that there were purposeful scare tactics to get people to do that. That's my own personal opinion.
I got one quick one I want to tell you here, and I can't resist. So the dean of the School of Public Health is a guy named Dr. Hand. Nice guy, came from South Carolina. And we're so close that we meet, you know, every couple of months. And he was on the Public Health Impact Task Force. And so I like to needle him every now and again. So Dr. Hand back when you were in South Carolina, you all had county health departments, didn't you? Oh, yeah. And where were you in that ranking of county health departments nationally? Oh, South Carolina was 46th. Well, we're 49th, right? Thank God for Mississippi. And so they went from a county health department, they had change in politics, and they went to a regional. They had 8 regions through South Carolina. And then after a couple more years, over a period of 10 years, they went to a single health department, which is in the city of Charleston, ironically, and everything flows from them. So there's one health officer and everything flows them. And, well, Dr. Hen, where are you guys now? Well, we're 46th. So it had no impact whatsoever. It was a political thing. It's shifting the money around, but it had absolutely no impact on the health of the citizens. But we think, I think if you ask any of us, we would tell you, you improve the health of the citizens, that has such a ripple effect that, people think, well, you lower your insurance rates, you bring in the business, all of those things are attached to it. Whereas you go the other way, it's a pretty slippery slope. You're not going progressive.
Judy, you got any questions? Steve?
Can I ask a question?
Yeah.
It just seems like, okay, the last 6 months, I've been to all the association meetings and all that. This is like, you guys, I've heard things and I've seen things, and you guys talk about regionalization a lot, but now you're saying you don't want to regionalize. What changed?
We've never
That's
been,
what I've always said.
been opposed to regionalization.
I have too.
Never have I been a
Yeah,
proponent of
that's not
that.
been changed.
We've talked about what the impact would be, but only to say what will regionalization look like if it was forced on us, but I don't think anybody, at least at that table.
Even the core concepts of the association that were put forward, the very first one is local authority, local autonomy, and local control. The very first one, it's always been that way.
Then
You guys
let's,
are always talking about regionalization, and then, just on my
Let's follow
personal
up on that.
opinion,
You
the Pack
talk-
region hasn't really been welcoming to me. But
let's talk about that part of it. Then you said that you talked about what regionalization would look like if it did happen. So if it does happen, what do you see it like?
If they regionalize the entire state, that would require a change of Chapter 16. We've heard a lot of different ways how they would break up that region. If we were allow input in that region, I would think we would, again, try to work hard to be regionalized with this 6-county structure. Some of the things that were put out forward indicated that they would regionalize. I know Dr. Mace from Mid-Ohio Valley put forth a regional structure would include, that structure included regionalizing these 6 counties together. And other different structures, but we would push to be regionalized together and function in that structure that way.
Steve,
But how would that function?
Go ahead. Owen.
That's what I'm asking.
That would be determining on how we're not going to regionalize unless we're forced to do so. And I would think that guidance would have to come with that law or that direction. They would have to tell us how we were going to do that. Volunteer to do that.
Steve?
Well, first of all, it's impressive that all the county administrators came down to Dockers.
Yeah, we
Thank you all for coming.
Appreciate that.
I think from my perspective, just as one of the 5 board members of the Doddridge County Board of Health, is that I want to make sure that Doddridge County keeps a health department, whatever that looks like. Because, and within this region, I'll be honest with you, what I see the big disadvantage to Doddridge is that you guys, all 5 counties, are tremendously larger than Doddridge County. And probably, and of the region, we're certainly the poorest county. I think we've got 7,800 folks roughly in the county. And our folks would be, if this health department wasn't here, they're not going to come to Clarksburg. They're not going to come to Morgantown. They're just not going to get help. That's just the way that it's going to be. So as just speaking for myself, my goal is going to be to make sure that Doddridge County has a strong health presence in Doddridge County. Otherwise, our folks just won't get served. And so I think that, and I think you're right. I stay pretty close to the legislature. I don't think the regionalization is going to happen for the time being. But at some point, I think that, state finances are going to dictate that things change. And so, at that point, I think that I'll be pushing for whatever is going to be best for Doddridge County, and I'm sure you all feel the same. You would do the best for Harrison County and best for Taylor County.
And
best
that's,
for Mon
that's the
County.
strength of this group. We'll push for our county first and then see what we can do to work together to cut costs and do all those things. But it's always about your county.
Well, let me ask you one more question. So let's say that regionalization was a reality, and basically the powers that be down in Charleston just threw it out there and said, okay, counties, you guys glob together as you want to glob together. And they don't just say that, you 9 counties, you guys are in one region, and you 9 counties, you're in one region. Would you all be willing to make a promise to Doddridge County that we keep an office in Doddridge County and provide help as a region?
I would. Because I think again, what we have said all along, you have to have strong local presidents, someone to provide services. And again, I don't think it's absolutely feasible. Doddridge County has a nurse this day. Now, she won't be back till Thursday. Yeah, you can save money by doing that, but then you're not providing quality services for your citizens. You're certainly going to increase the health disparities that we certainly have now. So I think there's, in my mind, there's absolutely not a way that you couldn't have staffing every day. I think, again, how that may look like, and there's a lot of details to be worked out, but I see no reason why it couldn't be that way. Let me, if I may, just touch on regionalization. All of you know, and listen, all of you are sounding to me like you're pretty astute. There's a lot of false information going on how much money you can save. I would encourage you, ask questions, show me the pudding. So having said that, there was a study done by Dr. John Deskins at WVU. He told me himself that he didn't have the information on the backside that he needed before he chose to do the study. He thought it was going to be a robust study. But it was, all his study was confirming the methodology that Middle-Ohio Valley had given him. He will flat out tell you, and to follow up what you said, that yes, regionalization is worth looking at, but you're years down the road. That's exactly the terminology that he used. What he told me was the intent of his study was to say, you know what, we need to look at it, but it's not something that can happen overnight. Because when you start doing things overnight, that's a sure prescription for failure. So I think at some point it'll happen. I think finances dictate that, but I don't think it's in the very near future. I mean, Dr. Deskins said we're years out. I'll also tell you, budget-wise, we have not had a budget cut in terms of dollar amount for the last several years. The only reason why we're even talking about budgets now is because of Dr. Gupta. He is the one who put the $4 million proposal into the governor, so that's why it came back from the governor's office. Obviously the governor says, I can save you money. Sure, he's going to take a look at that. So that's the challenge that we have now is where they come from. Up to this point, public health has been pretty much shielded. Sure, we're paying for goods and services now that we didn't pay for, but they're not all that significant. But in terms of dollar amounts, we've been pretty stable. We think, and I follow up on Dr. Smith's comments, we're going to have a new governor come January. We may have a new secretary, and we may have a new commissioner. We think then, given that climate control change, that we might have the ability to really put forth what we think a good picture of public health look like in terms of funding and those types of stuff. So I think, there are those who will say it's all doom and gloom, but I think the future is bright for local public health.
One additional comment that I want to add to what Lloyd said in terms of the funding. We were at the task force meeting in Charleston, and I'm thinking it was one of the first ones. You were there, I was there. They're showing, in fact it was the first one because the Bureau put up their slide presentation of funding, and they kept talking about all these millions of dollars going into public health. But when they showed the slide, it was a pie chart, and it caught my attention immediately. Our piece of that pie is 9%. Our piece of the pie is so small that they couldn't even write our name in the pie. We had to be down into the margin of the pie chart. 9%. So I think there's an argument to be made right there that, if you take a 4% cut across, if you have to take a cut, maybe a 4% cut across the board instead of a 25% cut out of that little bitty 9%. And I stood in another meeting in Charleston and asked Dr. Gupta directly if he was projecting a 4 to 5% cut at that time, maybe as somebody said here, as high as 10, but the conversation was around 4%. And I asked him directly, is that going to be across the board, everybody? And his answer to me at that time was yes. So I'm thinking that he has a motive in this, that he wants regionalization. As the doctor said, I think he's burned his political capital toward that goal now, and he's tried to make it happen in a variety of ways. And I agree. I don't think it's going to happen this year. It may happen someday, but I don't think it's going to be this year. But a 25% cut, and that's one of the arguments I intend to make tomorrow as we go about our meetings, is a 25% cut out of a 9% piece of the pie. I mean, is that good finance management right there? It doesn't seem like to me.
We had the president of the Association of Local Health Departments.
Sorry, that was Lisa.
I was on the task force, public health task force. We met for a year. We're talking about the first thing I had the opportunity to brief that task force on the first day, and spent an hour briefing the task force on what local health departments had determined to be important to them as far as the Local Health Association, which is representative of all health departments. And our theme was local control, local authority, and local autonomy. And every other slide here not. So in answer to the gentleman's question about do I think you need to have a presence in Doddridge County, absolutely.
Yes.
I mean, I agree 100%. If you don't have a presence in Doddridge County won't be served, or not, especially not at the level that they're being served now.
Tim, you got anything?
Well, our people has always stood behind our health department. We can prove that with our levies. I see only 2 you all have a levy. I don't know if you've ever voted on one in your other counties or not. But our people has always stood behind us for our levies, for our health department. And like you say, if the health department goes, the levy goes.
Absolutely.
Can I make a comment?
Well, yeah, you can, I suppose. Go ahead and make
To
it.
follow up what Lloyd said, I read I don't know if I guess he's Dr. Dept, he's John Dept's report. And he actually made a comment about regionalization in that report as being problematic in West Virginia with respect to the number of rural areas that need to be reached. That was specifically said in a couple of sentences in that report. And the second thing being, I had a guy tell me that he'd done some research, and I'm not going to say who it was, but he's a fellow administrator of you guys in another county, where in the last 17 governor changes that have been made in the state of West Virginia, only on one occasion did the governor retain a commissioner for the Bureau of Public Health. Only one time in the last 17 changes. So that kind of goes along with what you said too, Lloyd, about changes politically.
I would make one more comment as well. I have absolutely no confidence in anything that John Deskins puts out. I mean,
He seems to bring that out.
he doesn't do his research, and most of what I've seen so far is pretty faulty.
Again, I got to be honest. I think you just need to look no further than who convened him to do the research.
Yeah, exactly.
I come from Mid-Ohio Valley through Dr. Gupta, Bureau of Public Health. Again, if I ask you to do research, what's the chances of you disagreeing with me 100%? Tell like it is. So I don't disagree with you.
But even at that, though, he was able to make that comment that was a disparity he even saw with being able to reach local folks in remote areas.
Yeah.
I do think, one last comment I'd like to make. I think in all of this, though, it's really important for us to keep in mind that we do need to look at ourselves and how we do things and the way we do things in our own counties. I mean, we are 49. There is great improvement that can be made.
Absolutely.
And I think we have to be very careful that we're not saying we're opposed to all change. I think it's vital we look at what we're doing, how we do it, and we have to serve the people we serve better. We need to improve health. I don't think regionalization is the way to do it, but I think it's really important that we be looking at those things.
Yeah, that's very true. But I don't really But yes, I mean, the local boards of health, I mean, we can be better. You know, it's like any organization, you know, you can always get better. A football team can get better, a basketball team can get better, you know, we can get better. But, you know, you're kind of, we're 49th because the people of West Virginia and the healthy lifestyles that we choose. You know, if we don't eat right, if we smoke, if we do all these things, we're going to be 49th, and you guys can't overcome it. But we can get better. We certainly get better.
The accreditation readiness is a good piece to exemplify that, and that's a piece that's best accomplished in a collaborative effort among the group of us too.
Debbie, you got anything you want to say? No. No questions? No. Well, Tammy.
Okay, you all are all talking about the cuts, and whether it be 4%, 8%, 25%. What could you do together as a group, starting this year, to recoup that money? Some way, save money to recoup that money.
Improve billing practices.
But would you do it, she do it, he does it? Or would you have a centralized billing office instead of paying 15 different billing offices?
No, I think that if somebody wants to farm that out, that's their own
Could you
call.
work together in
Oh,
a-
absolutely. In fact, I've offered that in Deskin's paper, he holds out that Montague County has the highest level of repayment. And he does it based on per population. We do it on patients we see, but.
We saw some holes in that research, though.
Pardon me?
We saw some holes in that research, so.
Well, but the math is there. You take the amount that you bring in about the
But
population.
my
You can
point
figure it. I
is,
mean,
can you ward off or stave off the regionalization, the pain from the cuts that's going to push you into regionalization by doing stuff together now without the tab?
We already do.
I'm talking about other things.
Yeah, I think
But we do help each other in terms of information about billing. What do you need to do? What's the paperwork you need to fill out? What are the steps you need to go through?
How do you get credentialed with this provider, et cetera, et cetera. But we've already saved, I mean, my county saved $5,000 approximately in a community health assessment just already.
Is Douglas County part of that?
Yes.
Yeah.
let me further expand that onto you. Back 2 years ago when we started doing billable services, I'm kind of administrator. I have to know everything. So late night, evenings, weekends, I'm doing a lot of research. So I came across the state of Kentucky. Now, you know, they're pretty much mirror us in terms of structures. So I made contact with them and had a lot of conversations. What Kentucky does, they do preventative services in local health departments provided by RNs, and it's a billable service. When you look at the Affordable Care Act, it puts a lot of emphasis on prevention. There are a lot of things that we can be doing in local health departments, and it can be done by RNs, and it's a billable service, preventative services. When we talk about changing health outcomes, we need to start working on prevention if we're going to save it on the backside. So I have been 18 months trying to get the state to move in that direction. I gotta be honest with you again. We had a lady within the bureau saying, you know what, we'll help, we'll facilitate meetings, we'll do what we can. Well, because there's such an adversarial relationship now, that didn't happen. So I talked to Jeremiah Samples, as Deputy Commissioner, early December. We convened a meeting December the 18th. We had Medicaid, we had all the Medicaid HMOs present, and all agreed that yes, we need to move forward with this initiative. The problem now is getting Medicaid to look at their policy and legal review to see what barriers keep us from moving forward with preventative services. I think preventative services are going to be a key for sustainability for all local health departments if they choose to do that. Now, we're probably, you know, again, when your bureaucracy moves slow. So how long is it going to take them to finally get us to pre-approve to do that is anybody's guess. But we are working on sustainable through billable services and those types of stuff. Just looking at what we're doing, and I'm sure all of us evaluate our services every day. What can we do better? Where's my expenses? Where's my revenue? Can I increase revenue? Can I decrease? We do that every day. There's only so much you can do with the services that you have. So when you look at expanding services, I think there's a real niche for preventative services in local health to be done by RNs. If we could do that, then our fixed costs pretty much stay the same. You may have a few variable costs, but whatever we see should be pretty much about 99% net revenue. So those are some things that we are working on in terms of long-term sustainability moving forward.
I think another example would be what we have, it's called the program plan. That's all your deliverables, okay? And there is talk in Charleston that will expand, that will be requesting you do additional services or different functions. And one of the things that we have right now is in the area of threat preparedness. And there are reports that need to be done quarterly, etc. Now, what we see is that these increased deliverables is leverage for Dr. Gupta to withhold funding if you're not jumping this high. And so if the reports aren't getting done or there's need to help, we already do that. We help each other in this region. We try to make sure that, reports are done. You need anything, what can we do to help? You get that deadline and, it's visible to who's doing it, who isn't. And sometimes you get behind, sometimes in a place like this where you got, everybody's wearing 4 different hats, it's easy to sort of get sidetracked. So we look to try to equalize the burden on that because the funding is going to impact all of us. So I think those would be another example of how we would try to help each other to overcome these things.
We do that now. We have he's not full-time, threat preparedness coordinator, and all these folks can tell you, including Debbie, that they call on him a lot. So he makes sure all the reports are done, etc. So we do that on a regional level within our region now, in that arena. Again, with an effort just to help somebody, and we don't get 10 cents for it. So it's just a matter of, because I think it's that important that we help each other.
We're doing similar to that in Harrison County, where all the nurse directors from all 6 counties come to Harrison County, are working on policies and procedures and developing that manual, making it accreditation ready hopefully as well, together, as opposed to trying to do that in each county. So we'll say time and money as well.
I would just end by saying that if regionalization comes, I'm not sure that that's the right answer, setting in a big county. I'm not sure all the benefits it would have. I look at the southern part of the state where the Center for Local Health is saying, help your county out beside you. If you're in Mingo County, you're reaching out to McDowell and, I'm not sure what the strength in numbers is with that. Here, we're pretty healthy, but I think the difference is that we would like the opportunity to analyze what it is that we are doing correctly, where we can make opportunities for improvement, and go forth. And if it turns out that by working together in a cooperative manner, regionalization may help in certain areas, then by all means. What we're facing right now is we're being given ultimatums, we're getting financial threats, people are maneuvering, and we're going to resist that because that's just not the way we're wired to accept that type of stuff. Charleston doesn't always know. None of the people at the Bureau for Public Health, other than Dr. Gupta, has ever even worked in the health department. So it's hard for them to give us advice when they have to ask us what the answer is so they can put it in policy. So whether or not it comes in the future, I'd like to at least be part of a process where we agree that that's the way to go. And maybe that's the best, but we haven't reached that point. And when the Public Health Impact Task Force ended, it was my understanding that we had this next year that we were going to look at those things, and all of a sudden that changed into something else.
That report's available.
Mark, you hear anything else?
Well, I think one of the things that, maybe the world needs to realize is, like Steve said, we're, by per capita, we maybe even be the poorest county in the state, but government funding per person, right now, we're either the richest or second richest county in the state. I mean, with a 2-person vote on the county commission, we could basically do whatever we want to do right now. If the community wants us to do, Charleston wants to make cuts to us, we're one of the counties says, fine, Charleston, do what you want to do. We're going to maintain our health department.
That's due to oil and gas.
Yeah.
But at the same time, like Debbie's pointed out, the assessments and the unfunded mandates that they're putting onto the health department is going to raise that price up even more.
Oh,
and
yeah.
I mean, I see where she's coming from too.
Oh yeah, that's what we're concerned about, whether we can sustain, but we're probably better situated than most counties in the state right now.
$100,000 of meetings been handed out. So.
I may have a much bigger population, I mean, we're 33,000, but I know very well the mentality of, we don't have a DMV, and people think it's no big deal to run to Morgantown to get your driver's license. It is a big deal to run to Morgantown. It's a big deal that we don't have prenatal care in our county, to go outside the county. It's a big deal. We know what that's like. And, there are a lot of people who think, say you go one county over, it doesn't matter. It does matter. It matters
to those
a lot.
people that don't have the transportation to get there.
That's right.
The ones that need it the most. And like Steve said, I agree with him 100%, they just won't get it.
Well, we don't even have public transportation to get them there.
No.
But it's a lot easier if you live out of Big Isaac or if you live out Oxford to get a ride to West Union than it is to get a ride to Clarksville.
We've been known to pick people up.
But I'll tell you, one thing that we all have in common, nobody knows how to take care of Doddridge County better than Doddridge County. Same in Taylor, same in Harrison, and that's the point right there that I think we all need to cling to.
Yeah.
Yeah, I say
Well,
amen to that one.
Well, ours has been, like Clinton said, the voters, the people of Doddridge County have been very supportive of the health department, I think, we could rally the troops real easy. I mean, they really like the health department, And home health is a big part of that.
Yeah.
I mean,
our home health, in Taylor County, we're the hometown team. That's one of the things that's making us successful with that. We've got, the people in Taylor County look to us. They count on us. They know they can trust us. We've built relationships over the years in Taylor County, as I'm sure in Doddridge County, being a small county, everybody knows everybody. Everybody helps one another, neighbors. You got neighbors and stuff. So that's one of the things I think that makes us similar in Taylor and Doddridge. And that's why I stand firm on, making sure that our counties can stand up and do what they need to do for themselves.
I think Steve pretty well said it earlier, the fact that, that the board right now, I think, is, correct me if I'm wrong, but they're sort of in on it the same way. They want to stay Doddridge County. They don't want to go regionalized. They don't want to go in, let's do it ourselves. And so I think, as I said, in the next few weeks, we'll be discussing this and what you all have brought to us and come up with some kind of solution. And hopefully by then we find out that they're not going to do the 25%.
Amen to that.
And
About 3 weeks left, I think, about 3 weeks we'll know.
20 days.
Not that we're counting.
But we want to thank you all for coming.
Yeah, so thank you for having us.
Right, and we'll certainly keep this in mind, what you've got going for you, and we'll go from there. See what happens.
Fair enough.
Fair enough? All right. And if you have any extra money, please bring it.
Good to meet you. Nice to meet you. Have a good evening. Good to meet you, guys.
Thanks for having us.
Thank you.
All right.
We don't have any extra,
What you got?
There's a match.
They didn't know each other, well, they
Charleston, and then we went to a year from
Twice a year,
Well, I don't know about that. Tell you what, we've been through a lot. In the last 20 years. The trailer we were in,
Sometimes all you can say is you survived it, right?
Above the Board of Health, there's a conflict.
Amanda Simpson?
Mine either.
You don't understand that. I'm just.
Never been a cow.
And I. And that gave her that black look.
No, I'm not Oxford. Have a good evening.
You're closest county sheriff, Rich. Anything we can help?
Yes, yeah. BJ did tell me this earlier this year, so, yeah, I'll come down.
You don't get caught like the cold severance tax.
Them walnuts and
He was very Yeah, I told her 2 tickets. Mandy probably goes, she's off work.
Are you guys questions?
Ask a question, put his honest opinion. You want us to represent the legislature, and all these guys are working together.
I saw your hand up, but I was trying to get the board members. That's what I was trying to do. Oh,
Yes.
that's what we want to do.
There you go.
I'm glad you made it tonight, Steve.
Thank you, sir.
I've had trouble with the awarding plan.
This I had done Wednesday, so she started putting drops in it.
Are we done with the
So I had done 2 weeks ago. So I with my head back, and seen Lori out. I knew what it was.
Say what you will about Nancy.
I think so.
Put yourself in there.
Thank you.
What was the year in October?
I'm gonna turn